85% of those bodies showed a 2 times level increase of water in the lungs. So what was happening is when this drug is pushed, it causes a drowning, and it's stated as akin to dying by waterboarding or drowning. Meaning, the reason people in Canada who are given MAID seem peaceful is because they're giving a paralytic first. So they're completely paralyzed, then this drug is administered as one of the 4, and they start drowning to death. They're drowning to death. We waterboarded people in Guantanamo. There's a reason we had to stop. It falls under cruel and unusual punishment. Yet we are having people like dying with dignity say that this falls under compassion and empathy, when you're drowning people chemically to death.
There's a lot of talk going on about an activity book that was made for children here in Canada regarding MAID, medical assistance in dying. I've looked into the activity book, what it says. There's 3 different ones. And so it's become clear to me what is happening, what is not happening, what the agenda is for 2027, who's allowed to get MAID, who's not. We're going to go into that. If you don't have time to look at all the documents, the government documents, this activity book, all of that stuff, I've done it for you. I can go through what is happening, what isn't happening, the slippery slope, and normalizing MAID in the minds of kids for adults. All right, here's the Medical Assistance in Dying MAID activity book made for children, and it normalizes MAID, and it is explaining to kids why some adults choose MAID. It isn't, for now, normalizing that kids get MAID. It's only normalizing why some adults choose MAID. They created some other books as well. Me and My Illness talks to kids about their illness and how it affects them and all sorts of things in their life. And as disease progresses, how things can be different. I went through the whole thing with Me and My Illness for kids. They do not promote children to consider MAID for themselves. I went through all of the pages. They just talk about their illness. I also looked to see if they tried to sort of guilt kids into considering that maybe their illness affects others in a way that is hard, meaning emotionally, physically, and monetarily. So I didn't find them trying to guilt kids out into thinking that because they're sick, they're putting their family through hardship. I went through it and they don't do that. In My Life, Their Illness, they do discuss how illness in somebody else can affect another person, where they can become sad, upset, and all that stuff. So the MAID activity book is the main one here where people are thinking that this book is normalizing MAID in the minds of kids. That I see they are doing. They're trying to explain why it is that some adults and elderly choose MAID. They talk about pain, suffering, not being able to handle it anymore. And yes, they are normalizing why some people choose it. However, with how fast things are shared on Facebook and social media, some people are thinking that they're convincing kids why they should choose MAID. Now, people are upset, and I am too. They are wanting to change it so that people as young as 18 and up can choose medical assistance in dying for mental issues. That is something that they're trying to do. And there is talk about allowing MAID for people 16 and up for non mental illness. So there's a lot going on at the same time. Some of the government is trying to change things that might happen or are happening in 2027, and they're all being muddled together. So we just need to be clear which aspects of MAID are being changed and which are not, so that we're sharing the proper information. If you want to read this book for yourself, you can go to dyingwithdignity.ca. You can read all 3 that are made for kids. So here is also where confusion has, I think, happened. So this Dr. David Amis says, is it right to forbid mature minors access to assisted dying? And it's all within the same site. This is true. They are asking that question because some of them want to change that. But again, it's not for mental illness only. I'm not saying what's right or wrong here. I'm just saying what they're actually doing as it stands now. Okay, in his latest post for DWDC blog, Dr. David M.A.I.D examines the Council of Canadian Academies report on the possible implications of extending assisted dying access to mature minors. In this piece, he asks a difficult, he says, but necessary question. Is it fair to allow an 80-year-old with terminal cancer to access assisted dying, but deny a 17-year-old who has the same diagnosis and demonstrates the capacity to make medical decisions as an adult? Canada's law on MAID requires that applicants must be 18 or older, so it includes 18. It is worth noting before discussing the reasons for this prohibition that the number of children and adolescents who might contemplate MAID is fortunately very small, according to this author. Canadian Parliament, in passing the MAID law, undertook to dive deeper into issues surrounding assisted dying to determine whether any changes to the law should be enacted. The government is looking at it. The federal government did ask the Council of Canadian Academies, a nonpartisan think tank, according to this author, to study the future of assisted dying in Canada. In its studies, they examined three groups of Canadians who are generally excluded from accessing MAID: mature minors, people whose primary underlying medical condition is a mental illness, and individuals whose rights to a peaceful death is out of reach because of the ban on advance requests for assisted dying. So, in his report, they said that in Canada, people under the age of 18 are not eligible for MAID for anything. And this advocacy group is saying, hey, we think people who are having terminal illnesses from 16 and up should be able to access this. Now, the government is interested in this for financial reasons. Everything to do with the government is about money. So if they can have people who are 16 and up able to end their lives quicker, then the government saves money on healthcare. This is a reality. I'm not saying it's right, but this is what the government cares about. They save a ton of money in our mainly socialist system. And they'll save a ton of money on people who are over 18 who would like to take their lives for mental illness only. Mental illness is on the rise for numerous reasons. And so, because Canada is in a crisis of healthcare, they want people to be able to come in and do this to themselves. This show isn't about how horrific the way they do MAID is. I've been reading up on, because it's cheaper, the method they use for MAID, which experts have said is like a slow drowning. I've been looking into this. That's a whole nother show that I've been looking into. I'm trying to get an expert to email me, libertytalkcanada@gmail.com, liberty spelt normally. I would like an expert to be able to come on and tell me all about why the way they're doing MAID is like a slow, awful, painful death, like you're drowning slowly because you're paralyzed. It looks peaceful, but really you're drowning slowly. So, what I've seen from the experts going on other shows is that this is actually a horrible way to go, but nobody knows it's a horrible way to go because you're paralyzed first, so you can't express how long and arduous this process is.
Paralyzed then drowned, veteran exposes the terrifying method used to euthanize people in Canada. Send an urgent message to Canadian legislators urging them to stop expanding assisted suicide. LifeSite News, while marketed and pushed under the guise of painless compassion, the method used to kill Canadians under the nation's medical assistance in dying, MAID, euthanasia program may actually be akin to waterboarding. During a May 6 episode of renowned anti-woke Canadian psychologist Jordan Peterson's podcast, Kelsey Sharon, a combat veteran and artillery gunner in the Canadian military, revealed that the drugs used in MAID essentially waterboard a person to death. May 28, 2024. What I found out yesterday that really bothered me was the mechanism of the actual procedure, she began, comparing Canada's current practices to those in Nazi Germany. The reason people in Canada who are given MAID seem peaceful is because they're given a paralytic first, so they're completely paralyzed, then this drug is administered as one of the four and they start drowning to death. Sharon cited the testimony of Canadian Dr. Joel Zivit, Associate Professor of Anesthesiology and Surgery Emory at the University School of Medicine Atlanta, Georgia. In February 2021, Zivit refuted the Canadian government's claim that midazolam, a drug used in MAID, provided relief from anxiety and comfort to the patient. Instead, he testified to the Canadian Senate that muscle relaxants when used in MAID will produce death by suffocation. The MAID protocol very likely causes lung congestion in a similar fashion to that which has been shown in over 200 cases of lethal injection in the US, he said, referencing a Freedom of Information Act request containing the autopsies of around 300 Americans who were executed using the same drugs as Canada's MAID program. According to Sharon, 85% of those bodies showed a 2 times level increase of water in the lungs. What was happening is when this drug is pushed, it causes a drowning, and it's stated as akin to dying by waterboarding or drowning. In his testimony, Zivit explained that the muscle relaxant drugs given during MAID will produce an outwardly observed stillness as a consequence of muscle paralysis that has wrongly and repeatedly been described as a state of peacefulness. The only way to refute the hypothesis that the MAID protocol causes pulmonary fluid accumulation and death akin drowning is by obtaining Canadian data through autopsy studies on at least 200 individuals put to death by MAID, he argued. Sharon further revealed that Canadians who received MAID could be internally drowning for some time while their bodies are completely paralyzed. Dying with Dignity says that this is a painless death, she stated. Well, if you take MAID orally, it takes between 30 minutes to 24 hours. 24 hours of active drowning while you're under a paralytic, Sharon declared. That's how Dying with Dignity in the Canadian government has disguised MAID, while they're offering it to Canadian veterans instead of treatment, so they don't have to pay for their pensions, so they don't have to pay for their healthcare, she lamented. Sharon further revealed that the Canadian government has chosen to give their citizens a terrifying and sometimes lengthy death as a way to save on providing real healthcare. In 2021, they had a gross reduction in healthcare of $19.2 million, she said. When they did MAID, they saved another $22 million. By the end of it all in that year, the healthcare system, just from doing MAID instead of actually giving people palliative of care, saved $86.9 million, Sharon continued. We deserve better, and so do our kids, and so do our citizens. We don't deserve this, Canada, she declared. I've seen this done to someone, she continued. You don't wish that on anyone. It would have been easier, it's easier to put bricks around my feet and go jump in the ocean than it is to die by MAID. That is a terrifying way to die. In Canada, MAID does not yet apply to the mentally ill, as the Liberal government decided to delay the expansion of euthanasia to those suffering solely from such illnesses until 2027 following backlash from Canadians and prominent doctors. In January, provincial health ministers went a step further than seeking a delay in the provision, asking for the measure to be indefinitely postponed. A request that has yet to be accepted. The most recent reports show that MAID is the 6th highest cause of death in Canada. However, it was not listed as such in Statistics Canada's top 10 leading causes of death from 2019 to 2022. When asked why MAID was left off the list, the agency explained that it records the illnesses that led Canadians to choose to end their lives via euthanasia, not the actual cause of death, as the primary cause of death. According to Health Canada, in 2022, 13,241 Canadians died by MAID lethal injections. This accounts for 4.1% of all deaths in the country for that year, a 31.2% increase from 2021. While the numbers for 2023 have yet to be released, all indications point to a situation even more grim than 2022. Send an urgent message to Canadian legislators urging them to stop expanding assisted suicide.
Why are they not doing it another way where it's super quick? Probably to save money. That in itself is disgusting. And they're basically saying here that if kids can decide on other things to do with their lives, like surgeries, vaccines, all that stuff, then they should be able to decide to take their lives. And this fellow, Dr. David, says it is illogical and cruel to deny the mercy of MAID to a very sick person purely on the grounds of age. Slippery slope. If they make it so that you can do it from 16 and up, who's to say in 5 years when the government sees all the money they're saving, it won't be 14 and up and then 12 and up? Because there is a country right now that allows it 12 and up. The current status of MAID for mentally ill minors in Canada, I looked it up. MAID eligibility and age restrictions. Under current law, MAID is restricted to individuals who are at least 18 years old and have decision making capacity. This means minors, including those with mental illness, are not eligible for MAID. But for adults, the eligibility criteria require that individuals have a grievous and irremediable medical condition, which does include mental illness, but only for adults. This expansion to allow mental illness as the sole condition for MAID has been legislated but delayed until March 17th, 2027, and still applies only to adults. So, this is where the confusion has risen. You've got kids given these books, coloring books, activity books, normalizing MAID. And then you've got this 2027 March 17 thing happening where adults can go in and off themselves because of mental illness. They've been trying to bring it in for quite a few years, and there's been a ton of pushback. Well, it's back. The expansion to allow mental illness as the sole condition for MAID has been legislated, but delayed until March 17, 2027. And from what I've read, people are already trying to sign up now for 2027 as it's only a year and a half away. And it does say here that claims suggesting MAID is available or will be available for minors as young as 12 by 2027 are inaccurate and not supported by current law or policy. But there are groups advocating that people should be allowed 16 and up to do it. All of these policies are being looked at, all of these advocacy groups and their writings have been looked at, but as it stands now, no, you cannot get MAID below 18. And I know a lot of us have seen that some users claim MAID for mentally ill minors, including those as young as 12, is planned for 2027. These claims are inaccurate. No such legislation exists, and the 2027 expansion applies only to adults. The critical examination of this is that while the idea of extending MAID to mature minors has been explored in academic and policy discussions, meaning Canadian government discussions, no concrete steps have been taken to allow this. The focus on mental illness as a sole condition for MAID has raised ethical concerns, as it should, particularly regarding vulnerable populations. But the government has maintained strict safeguards, including the age limit. Claims about MAID for minors, especially those as young as 12, appear to stem from misinformation or misinterpretation of committee discussions rather than enacted policy. I am again not saying that 10 years from now, this won't be happening, but right now, it's not. That's why pushback is so important whenever they take the next step, so that they can see that we're looking at the slippery slope and we're seeing that Canada's broke. Our medical system is in chaos. So, this idea to keep expanding MAID to save money, there's going to be people that say, hold on, we have limits here to saving money. So, good on you for continually looking at it with a fine tooth comb and seeing when they're starting to overstep what is appropriate. Now, one thing we really need to talk about though, is it okay that in Canada, if you're 18 and up soon, 2027, that you can walk into a hospital and say, I'm depressed, I want to end my life, and they'll actually do it? As we all know, 18 is like children still. I have teenagers, a lot of us do. And we're all aware that 18 is still a baby. You make all kinds of crazy decisions when you're 18. And so, for someone who has a mental illness at 18 to be able to walk into a hospital and end their life, I think that is disgusting. And they're not adults, they're not thinking straight. Sometimes it only takes a few things to set off a depression. And there's so many ways that you can get through this depression. There's even cover ups for bipolar, things that can help with bipolar. There's so many things that they could do to help them through mental illness. And they could have a bad month and literally go in and ask the hospital to help them take their life. 18 is not an adult. 18, we all know how we thought at 18. You're a child at 18, and parents have no right to have any say about an 18-year-old who's been living with them, who they understand more than any doctor will, who they understand more than any shrink will. You have no say as a parent when a teenager who's living with you, who's your kid, who you know inside and out, has a bad few months, and they can literally go to the hospital and say, "Bye, I'm going there to get MAID." This is horrific too. I don't think they should allow this for anybody, but my God, can you not do it from 25 and up or 30 and up? Especially since more and more and more people who are young, 16, 17, 18, early 20s, have mental illness. Why don't we figure out and treat mental illness instead of just saying, hey, let's get them off the government teat and let them do this? We all know that for the government, it's about money. The government wouldn't be looking at this if it wasn't about money. They're looking at how much they can save off the mentally ill from 18 up. So, although it's not being offered to kids under 18 as it stands now, I really think there should be a lot more pushback on letting somebody who's depressed, who's 18, walk into a hospital and do this. But that's my opinion. I don't know what yours is. Feel free to put in the comments as a parent or even as a non-parent or as a grandparent or somebody who lives with teenagers whose hormones are all over the map. I mean, you could literally have somebody fall in love for the first time and get dumped for the first time. That first time that you're dumped or you lose a job or you don't get into university, that can set off a depression that's debilitating. Should we let them to just walk in and make this decision when they could have been cured of it 3 years later? I just can't imagine one of my sons could walk in right now at their young age of 19. I have one that's much younger than that, but and do this. And the parents can't do anything, they can't say anything. Anyways, well, this document is interesting. This is something different. So this is called the Summary Brief Made for Mature Minors, and it's ourcommons.ca. It says Inclusion Alberta down here. So they remain vehemently opposed to assisted death on the basis of disability or disabling medical condition, death not reasonably foreseeable, including to mature minors. And they're going to list why. Canada's MAID legislation restricts death by MAID to those 18 plus with good reason. Fewer Canadian youth than older Canadians report having excellent or very good mental health. Suicide is the second leading cause of death for Canadian youth aged 10 to 19, behind only accidental death. Did you know that? I didn't actually know that. Unique vulnerabilities with children with disabilities. Children with disabilities are more affected by suicidal ideation. They have greater exposure, poverty, lack of belonging, unrecognized mental illness, and childhood maltreatment. 32% of First Nations people living off reserve, 30% of Métis, and 19% of Inuit age 15 plus have disabilities. And Indigenous youth are dying by suicide at disproportionate rates. So they're saying this is going to affect the First Nations more. So you're going to have more First Nations be able to off themselves if the government gets their way, which they want because they've screwed up our medical system so bad. They want as many of us off the government teat as possible while still not letting us decide if we can have private. You're stuck here. So unless you're a multimillionaire and you can fly to America, you're stuck in this system that's not working, and you can't choose to go get something that you pay for unless you go to America and you have to pay for flight and hotels. Minors are reliant on adults. This is especially the case for minors with disabilities. Most minors rely on adults for social and economic support. Youth with disabilities may be uniquely dependent due to the extra costs and challenges of having disability or to supports being provided by or through the family unit. Minors with disabilities are twice as likely to live in households that live in poverty. Parents of children with intellectual disabilities have to turn down employment opportunities, work less, or decline promotions. 17% of people with disabilities in Canada live in core housing need, with lone parent households, 32%, at higher rates. They claim in this document that minors with disabilities too often feel like burden to their families. 1 in 4 Canadians with disabilities cannot afford necessary aids, devices, or prescriptions. Minors are aware of the parental stress created by bureaucratic and unfeeling systems, leading them to think of themselves as a burden. Minors with disabilities are often ostracized and segregated. This can impact mental, social, and emotional well being, increasing the likelihood of depression, anxiety, loneliness, and low self esteem. This even happens with us adults. For instance, when you have a very bad injury, like let's say a back issue, and you've had a bad back for a year, or a bad back or bad neck for a year or two. This has happened to both my husband and me, where we're so debilitated because I was in an accident quite a while ago. This is way before COVID. I was in a really bad accident in Bali where I basically was in bed for a year with debilitating neck pain. I felt so guilty for what I put my kids and Norb through. And now Norb's going through something where he feels guilty because of what he's going through to do with some neck issues he's having, where like he's not as fun. We can't do everything that we want to do together. And it does become where you start to feel so bad about the inconvenience you're creating for others and the work you're creating for others, or maybe you're not helping out, helping in society. You can become feeling depressed that you're useless. I'm not saying you shouldn't. We all go through things and people should help. But I'm sure you've all experienced it, especially, around the ages we're at, where you can be debilitated by something for a while and you start to feel like, man, I'm a real hindrance. Well, kids feel that as well. That's what they're trying to say here, and that they might choose this method because of their guilt. Minors with disabilities are more likely to have experienced abuse. Children with intellectual disabilities are more likely to experience abuse. This can lead to perceptions that their life is not valued and neither are they worthy of life. Minors with disabilities are overrepresented in child welfare and move between foster homes more frequently. Suicide attempts are more than 3 times as likely in young people in care compared to non care populations. So now you've got kids who want to use suicide as an option, who are in these care homes, going between care homes and not being taken care of by one family that they can really lean on. Do you see what's happening here? The slippery slope. So healthcare practitioners may have an outsized influence. When assisted death is framed as medical treatment, the possibility or desirability of more complex, long-term, life-affirming interventions that lie outside the healthcare system may be eclipsed from view. We already know they're doing this with literal veterans who don't want to end their life. They're being offered MAID instead of expensive things they need to help them. Like I said, I had a guy on my show. I've had a few people, but a man on my show who just wanted them to operate on his brain tumor, but they would have had to do it more than once. It's too expensive, so they offered him MAID. He didn't do it. He was pressured. He got the operation and he's living a decent life right now because he also found alternative methods to deal with his pain, ones you're not allowed to talk about. But they're right because they're pretending that this stuff isn't happening, but it already is with adults. So, on a case by case basis, courts have decided whether or not circumstance allows for the standard process of consent to be modified, allowing for a mature minor to make their own healthcare decisions. The process by which a court reviews and assesses a minor's maturity and capacity for decision making in exceptional circumstances is a vitally important protection in and of itself. It would be extraordinary for the government to usurp the role of the courts in assessing individual eligibility. What they're saying is if they allow MAID for 16 and up, if they allow the slippery slope to happen, the courts don't have to be involved. A kid can just walk in, ask for this, and they get it. The alternative, legalizing MAID for minors more broadly, would be utterly irresponsible and unconscionable. So, Inclusion Alberta is a family governed nonprofit federation that advocates on behalf of children and adults with developmental disabilities and their families in their desire to be fully included in community life. Now, something that is happening that the government's doing that I think is completely irresponsible, and a lot of people do, this is a huge topic right now, is they can see that the socialist, mainly socialist system that they have going isn't working right now in Canada. Nobody can get what they need in time. And so this affects kids as well. So, kids, people who are middle age, older age, because lineups are so long to get care, people aren't catching disease in time or getting the therapies they need in time. And so this is affecting all of us. Some people can't even get a doctor to find out what's wrong with them. So we already know that because of how long it's taking for people to get in of all ages, detection of serious illness isn't happening in time. And the only people that can bypass the line right now are the super rich who can go to America and pay hundreds of thousands of dollars for what they need. If they allowed public to continue, like they do in some countries, and private, then people could have the choice if they say want to forgo a vacation. You know, there's people that are middle income, not rich, but maybe once every second year, they go on a $5,000 vacation or a $10,000 vacation. Those people should have the choice to not take that vacation and instead get therapies that they're still waiting for so they have more chance of survival and health. I think it's absolutely gross that our country is acting so communist that they won't give people the choice. This whole "it's not fair to poor people," well, that doesn't jive with me because poor people who can't afford a $1,000 treatment, they're waiting in line behind rich people who may have got in line ahead of them who could afford it. Can you imagine if we had a dual system? That would mean that those people that are middle income or upper income who can afford to go private, they would be relieving so many spots for people that can't afford it. It speeds up everything for everyone. So we've got this MAID issue. Well, instead of just trying, the government to take as many people off the government teat, maybe they should actually allow people the choice. But this country is becoming more and more communist, where we're not giving the choice to save our lives, even if we've worked hard and have the money to do it. Now, I couldn't afford a $400,000 operation that some Canadians are doing down in the States who can afford it. And that's the thing is, the really rich, as usual, they still have the choice. Canadians who are very, very rich can go down to the States, get a heart surgery, get that brain tumor removed, get some new therapy that America offers that Canada doesn't because Canada can't afford it. Uber rich, they still get to do what they want. But if you're middle income and low income, you don't have the choice to save your own life. That is a huge issue that needs more talking about. Let me know if you disagree in the comments, if you think that everybody should be using a system that no longer works. Maybe back in the day, this system works, but it doesn't anymore. So the government's spending all this money on experts to decide if they should just let people start knocking themselves off from 16 and up instead of fixing a system that's broken. Anyways, thank you very much for tuning in. Let me know what you think. I will see you guys next time. Did you know if the banks do a bail-in, they can take the contents in your bank vault? But storing your gold and silver at home could be a huge security risk. Every day, our dollar is worth less and less. Inflation is stealing the only savings families have. Now more than ever, it's so important to hedge the savings you've worked so hard for. Banks have been failing all over the world, and social credit has all but arrived. But did you know you can do wholesale price vaulting and retail delivery from the most prestigious, reliable company in Canada? Did you also know if you decide to leave Canada, your gold and silver can be sent right to you after you arrive to your destination? The only company I personally use and trust are those awake guys at New World Precious Metals. Take control of your family's future. You can just click the link in my show description or type in the web address libertytalkcanada.ca/gold to get on their mailing list, attend their webinar, or book an appointment. Let them know Odessa sent you.